Hello, my great family. How are you? I hope you're doing fine. I hope you're so good. All right, I see someone smiling at this point, and I know by the grace of God, we've been making a lot of impact through those teachings we've been making. All right, I'm about to talk about cancer. Okay, cancer. Okay, whatever cancer is, we are to understand it now, and we know that naturally we can stay free of cancer of any kind, okay, through the precautionary measures we have to apply at every given time, basically through the informations we are given. All right, so we remain CC Natural Therapy that is here to lively tell you the need to keep healthy, the benefits of taking care of your health and being in charge of your health. Right now we're talking about your information and greater knowledge on cancer, all right, and some basic factors that contribute to this cancer. Okay, let's go ahead. Right now we're talking about it. Cancer is a complex and multifunctional disease. There are some main causes of factors, okay, or risk factors that actually contribute to the increase, the spreads of this cancer. There are greater knowledge, advanced knowledge of it, but then let's break down to the little and very good broadened one that you actually take home and will help yourself through it. Okay, we're talking about some genetic factors that contribute to it. We'll be making mentions of environmental factors as well that actually increases our risk of cancer, the life factors amongst it. Okay, we'll also talk about the infectious agents that can equally contribute to it. Okay, we'll talk about some hormone factors that can actually contribute to this cancer disease. Okay, now let's talk about it. Okay, genetic factors that actually contribute to cancer includes inherited mutation. Some cancers are caused by inherited genetics. You know, mutations such as BRCA1 and BRCA2 for breast. In ordinary, okay, we have that for breast and ovarian cancer. The family history also, when we're talking about genetic factors, as we're talking about inherited mutation, you know, most times when you go to hospital to actually, okay, for instance, you are a mother or your breastfeeding mother or you're on antenatal, postnatal, sometimes you see the doctors ask you, if you're saying that you're having some pains in your breast and the rest of it, or even a single lady come up to a doctor and you see a gynecologist telling you that, okay, the gynecologist will ask you, do you have any history of tumors in your home? Or there are certain what's it called? These pills you take for fertility, to prevent fertility, to self controls that will do. Do you understand? You see that will ask you, have you any history of tumors in your home, breast tumors of any kind? You are being asked all this to ascertain some information, to know the best pills to give you, to know the best plans to set out for you. Now, when we talk about family history, having a family history of cancer can increase the risk of developing certain types of cancer. So you should always get information relating to your family. If your parents are dead, or your mother is dead, or your mother is suffering some issues, try to contribute, try to get some knowledge, try to ask questions. Know it so that it will help you in the nearest future over the things you take or certain medications you take, so that the precautionary measures will be attained earlier, so that know when those treatments have been ascertained can trigger some certain cells of cancer and tumors will start aggregating in the system and causing a lot of issues. So know your family history so that we'll be able to be saved. Okay, environmental factors also contribute to the risk of this same cancer. Remember, we say it's a complex one, a multifunctional disease that has been affecting affecting so many countries. Down here in Africa, a lot of people have been dying. Thank God for the safety we are having now. Thank God for the NGOs that is helping. Thank God for the chemotherapies. Thank God for everything that has been put in place in order to help mankind. Okay, so medicals are trying, and I say, the people at home, I say, may we all help ourselves to get healthy more, to avoid having those risks, exposing ourselves to cancer. We're talking about the environmental factors that equally help someone to be at the risk of cancer. We'll talk about the tobacco use. Tobacco is a leading cause of, okay, preventable cancer deaths. Okay, we can actually prevent certain death of cancer. If you can be able to avoid tobacco use, it will help you. Tobacco is a leading cause of certain cancers, and it can actually lead to death. Please avoid it. Help yourself now. The UV radiation, exposure to certain UV radiation from the sun, from thinning beds and increase the risk of skin cancer. Take charge of your health. Okay, please try to help yourself to stay clear from certain sunburn. Reduce the way you stay under the sun. Please, it can actually trigger certain cancers into our system. Radiation exposure to ionizing radiation such as from medical imaging or nuclear accidents can increase the risk of cancer. Please, let's reduce the way we go through radiations. Those are imagings that we do. Do you understand? If you're medically sound, please avoid always going to, let me do some x-ray, let's try to ascertain this. Please help yourself. And if you're pregnant, try everything possible to stay clear of those imaging machines. It might actually expose you to certain cancer. Air pollution. Know that air pollution today can actually increase your risk of cancer cells, okay? Exposure to air pollution, particularly particulate matters, can increase the risk of lung cancer. Remember, we're talking about cancer in general. We've made mention of BRCA1 and 2 that can actually be seen in breast and ovarian cancer. Okay, we are now talking about chemical exposures. Certain chemicals, those chemicals that are used in production of paint and the rest of it, can actually expose us to certain cancer risk, such as asbestos and benzyl and also peptides, can equally increase the risk of cancer cells. Life factors also can increase the risk of cancer cells. Okay, when I talk about these life factors, we're talking about the diet. A diet high in processed meats, sugar, and unhealthy fats can increase the risk of certain cancer. When we talk about that, please, in this year we eat the food, chicken, the meat that is not properly cooked, the meat, red meat that is not properly cooked, all those processed foods that we eat, we have to avoid it. It's not too healthy. Okay, physical inactivity, the sedentary lifestyle that can increase the risk of certain cancers such as colon and breast cancer, please avoid it. Obesity, being overweight or obese can increase the risk of certain cancer such as breast and colon and kidney cancers. Please reduce your weight, watch your weight. Okay, with this knowledge, we are going to be treating on how to reduce weight after this very topic. Okay, alcohol consumption. Reduce the way you take alcohol. All those whiskey and the rest of it. Excessive alcohol consumption can increase the risk of certain cancers such as liver, breast, and colon cancer. Please help yourself, as it can actually kill. Cancer can kill. Please, all right? Virtuous, certain ways you can equally help yourself is staying away from virus, certain infections or virus or bacteria. Other factors are hormonal factors. Equally, you have hormone factors can actually be another cause that can increase your chance of cancer. The age, okay, age from